my opinion on probiotics and maintaining gut health. And that's a really great question. As I mentioned, there's a trillion plus bacteria that live with us and many magnitudes of billions of bacteria that live in our gut. Most of the commercially available probiotics over the counter are a handful of species, and there's only a few companies that make it so that even though you may get a different bottle, it's literally the same species with a different name on there, with a different branding on there. And so the idea here is that we are providing good, healthy bacteria that are on average healthy, but you're putting it into a body that you don't necessarily know which variants you uniquely have. And so for some, you will find it to be beneficial by taking a over-the-counter probiotic supplement, but for others, it will just pass right through you because you have an abundant source of those already. And so what we really have to get into the paradigm or the mindset of thinking about is, let's measure the bacterial counts. There are kits available to do that. Figure out what is right and what is wrong, what could be improved upon, and target those directly to with the right bacteria for you as an individual versus what is right for potentially everybody out there.
Dr. Imran, there is another question for you. Again, just somebody's asking about the differences between the prebiotics and the probiotics.
Yeah, that's a great question. I didn't have time to cover that in my conversation, but probiotics, so the concept here is that of a farmer. So you have the seed, which is the bacteria, the live bacteria, that's a probiotic. And the concept of the fertilizer is the food that allows that seed to grow. Prebiotics are food. They're insoluble fibers typically that the bacteria feed on, your good healthy bacteria feed on, and that allows them to grow. So the seed is the probiotic, the fertilizer is a prebiotic, and there's many different variants of prebiotics, and depending on what you need, you pick that one too, to allow the good stuff to grow that you need.
All right, well, thank you. Dr. Nepa, there's a question for you. So some of them wanted to know what are the basic dental hygiene rules they can follow, like a 3-step rule, if you could, especially, even if there are teenagers, what would you suggest?
Well, the 3-step rule I would suggest is, okay, so it's a step, it's toothbrushing, tongue cleaning, flossing. So it's your toothbrushing should be 2 minutes long at the very least. Most brushes, electric toothbrushes now have timers, but if not, you can time yourself. Followed by tongue cleaning, and then the flossing, like I said. Try and floss once a day. I usually tell my children, do it while you're watching television. Or something like that. It's just it needs to get done, so to do it once a day.
Perfect.
And, yeah,
Perfect. Thank you. We have a question for all the panelists. Anybody could answer this. If fresh fruits and veggies are not easily available, is it okay to use frozen?
I can take that one.
Sure, Ghazala.
Okay, thank you. So absolutely, if fresh fruits are not available, frozen fresh is an equally good option, and sometimes even better, because when foods are harvested and their fruits and vegetables, they get transported, they lose a lot of their nutritive value during the process of transport. But when it's frozen fresh, it actually contains all the nutrition. So you do want to check on the nutrition labels. That's very important when you buy frozen items, to make sure that there's not much of salt and sugar and preservatives added. Other than that, frozen fresh is an ideal option. I would go with it. I have a lot of frozen food stacked up at this point because I'm not able to go to the grocery store as much. So go ahead and don't feel guilty about it. It's absolutely a good option. Thank you. Thank you for that question.
Thanks, Ghazala. Veena, there was a question for you. Some people wanted to know if you could share some of the other Ayurvedic recipes which could, help them towards their holistic journey towards in their health. Any pointers or any ingredients that you would suggest for them to include in their diets?
Oh, I see. Ginger. Ginger is one. It's a pretty, pH level is pretty good. Other than lemon, ginger is anti-inflammatory, and there are a lot of berries. And in ginger, generally, why we ask ginger tea, ginger and turmeric tea is turmeric is also anti-inflammatory, and it has a full of antioxidants. And the ginger, same thing, and the lemon alkalizes it. And then if you add some black pepper to it, and it absorbs all the nutrients through the gut liner.
Right. Thank you. Thank you.
And actually, maybe in future, these things we are thinking of putting a meal plan, whatever I suggested today, into more details.
Okay, perfect.
With more recipes.
Very nice. So people can reach out to you for that, for getting some of the meal plans or some of the tips?
Yes, sure. I put my email address here, inhow365@gmail.com.
All right. There's another question for Dr. Niba. Is it important to get the wisdom 4 tooth to be removed after 40 years?
It's only if it's recommended by your dentist, and most dentists don't recommend wisdom teeth extractions unless either they're infected, there are large cavities in it, they are inaccessible for you to clean them in ways where it would harm the other teeth. So if in any way it is deemed that these teeth are more harmful in your mouth than out, then we would recommend extractions. But we don't recommend extractions just because you're over 40.
All right, thank you. I hope that it answered the question. Ghazala, there's a question for you. They're wondering if Happy to Be Healthy, how did they offer their services?
Okay, sure. Thank you for that question again. So we offer our services through workshops that we have set up based on concepts. For example, we have workshops for adults and seniors, and we also do have concept-specific workshops which are science-based for children. As I said earlier, we work with the school district. So for adults, we have 4 workshops. We call them our prime time workshops because they're for adults and they're prime, typically over the age of 30. One of them is how to make health your hobby, where we teach you how to live a healthy life and just be passionate about making it your hobby. The second workshop is to help you manage living without pain and inflammation. That's the second type of specific workshop. The third one would be how do you open up your internal pharmacy? And we teach you how to do that. We all have an internal pharmacy, and we give you that secret out in our workshop. And the fourth concept would be how your waist size matters in terms of an indication for your overall well-being. And we also help you giving you strategies how to reduce that if that is an issue. So these are very topic specific. And then we also do give you workshops on different areas of interest that might be something that is current. For example, Veena mentioned the DASH diet, the Mediterranean diet, things like that in terms of what are fads and what is reality. And it could be topic specific again. So the workshops are offered for both adults and for children. Thank you.
All right. Thanks.
And
Dr. Imran, there's a question for you. They wanted to know what are the things, or few of the things that they would avoid to keep their gut healthy.
So in terms from a dietary standpoint, any processed foods, foods that don't that require wrappers and kind of things before you eat it. Probably avoid those. That's sort of an easy initial place. There are excessive use of antibiotics are a real harm to our gut microbiome. And so if you don't need to use an antibiotic, don't. Certainly when you do need to use one, do consider using a probiotics, either a supplement or a nice cultivated yogurt with that, or some buttermilk with the probiotic, as long as there's no direct, your pharmacist or your doctor says there's no direct interaction between the antibiotic and yogurt. You could use it time sparingly, a couple hours before or after that antibiotic, if that's the case. But that'll help at least start seeding back some of the good bacteria that you're going to lose by use of that antibiotic.
All right. And Dr. Imran, would you suggest any brands of prebiotics or probiotics? There are so many on the shelf, so it's hard to kind of even know which is good for you or which is just a marketing gimmick.
I think as I would probably reference back to, in terms of use for with an antibiotic, I would probably just, more than anything else, use natural yogurt, buttermilk, those kind of things. That's a much cleaner, easier thing. The brands are a little too tricky, and as I referenced to the original question, you have to seed back what you're missing, not just throw a bunch of stuff your way. So if you're having chronic gut issues or are worried about your gut health, there are tests available that we can certainly order for you and help guide that treatment process.
Gut health begins in the mouth. How would you elaborate on that?
Well, yeah, I think that Dr. Junaid did talk about that the bacteria that are present in the mouth and there are a lot of them, are directly affecting your gut health. And what you eat, how you manage your dental health, your oral hygiene, etc., can change those bacteria in the mouth, and hence can change your gut health. So, so in short, if there's optimum oral health, then you have the right kind of bacteria in the mouth, simply put, which then would help, in optimum gut health, all else being okay. So yes, the dental health is extremely important for gut health.
Perfect. Ghazala, there was a question for you. They wanted, the audience wanted to know the last slide of yours, which you mentioned that they were the top 3 fruits.
Yes.
Could you just remind the audience about this slide?
Go over that for sure. Yes. So the top 3 fruits, just to repeat, would be the first one would be avocado. Avocado is has about close to 20 vitamins and minerals packed in just one fruit. It's very nutrient dense. What is avocado good for? It's good for our heart. It's good for our vision. It helps with the risk, reducing the risk of depression. So there's some people, because of the situation of not being able to get out of the house, people are depressed because they're all cooped up. So maybe an avocado will help just lift your mood up. Try it, and it has a lot of nutrition packed into that one vegetable or fruit, whatever you like to call it. Very rich in omega-3, and there are not many fruits and vegetables that are rich in omega-3, and avocado is one of them. So it's a superfruit that is on the top 3. The second being papaya. Papaya is very rich in vitamin A and C. It has a whole lot of fiber. So it's very good for digestion. And it is also very good for diabetics. So that's one of the fruits people with diabetes can have in a controlled amount, because I know there are lots of fruits that are higher in sugar, and diabetics are not allowed to have those kind of fruits. Papaya, again, very good for digestion, and also it helps with the cholesterol buildup in the arteries. So, it helps reduce the cholesterol buildup in the arteries rather. So keep that in mind, and rich in vitamins and antioxidants. The third fruit is guava. Guava is, again, very rich in vitamins A and C. Very good with its manganese content because it helps you absorb the nutrition from your foods better when you have those minerals. So guava is rich in manganese, and as I said earlier, potassium. It has the same amount of potassium that we find in a banana, and potassium is very good in regulating our blood pressure. So those are the top 3 fruits because of the benefits that they have. Guava, papaya, and avocado.